Welcome to meeting number 147 of the House of Commons Standing Committee on Health. In accordance with our routine motion, I'm informing the committee that all remote participants have completed the required connection tests in advance of the meeting. Subject matter of the Supplementary Estimates B 2024-2025, votes 1B and 5B under the Canadian Food Inspection Agency, votes 1B and 5B under Canadian Institutes of Health Research, votes 1B, 5B, and 10B under the Department of Health, votes 1B, 5B, and 10B under the Public Health Agency of Canada. Pursuant to Standing Order 108 Sub 2, the committee is resuming its study on the subject of the Supplementary Estimates B 2024-2025. I'd like to welcome our panel of witnesses. We have with us today the Honourable Yara Saks, Minister of Mental Health and Addictions, and she has the following officials accompanying her today. From the Canadian Institutes of Health Research, Dr. Tammy Clifford, Acting President. From the Department of Health, Ed Orensak, Deputy Minister. Eric Costin, Associate Deputy Minister. Jennifer Saks, Associate Assistant Deputy Minister, Controlled Substances and Cannabis Branch. Michelle Boudreau, Associate Assistant Deputy Minister, Health Policy Branch. From the Public Health Agency of Canada, Nancy Hamzawi, Executive Vice President. Michael Collins, Vice President, Health Promotion and Chronic Disease Prevention Branch. Thank you all for being with us today. Thank you for your patience while we exercised our democratic duty. Minister, you have the floor. Welcome to the committee. We have a point of order from Mr. Doherty.
Mr. Chair, seeing that we're starting at 12:56 or 11:56, and on the schedule it has the minister here from 11 to 12. Do we have assurances from the minister that she can stay at least until 1 or 1:15 or?
We had this conversation as I came in the door, and she is able to stay for a full hour, so that should get us through 2 full rounds of questions. And then I'm in your hands as to what we do at that point in terms of officials, but we have the minister for a full hour.
Thank you.
Welcome, Minister. Over to you.
Thank you, Mr. Chair, honorable members. It is a pleasure to be back with you at HESA Committee, and I'm pleased to appear before committee today to discuss the Supplementary Estimates B as they relate to my portfolio as the Minister of Mental Health and Addictions. I'd like to begin, if I may, with the Emergency Treatment Fund, which was first announced in Budget 2024 to update the committee of its activities. While no community has been left untouched by the toxic drug and overdose crisis, some communities have been more affected than others. Through the Emergency Treatment Fund, we are helping municipalities and First Nation, Inuit, and Métis communities rapidly respond to their unique needs. This can include on-the-land healing, recovery and treatment, and harm reduction supports, such as naloxone and drug checking equipment. The first call for proposals was recently closed, and we are reviewing the proposals now and will be announcing the successful projects in the new year. The supplementary estimates propose $24.9 million to support municipalities and Indigenous communities right now. This is critical work. We are supporting community-based projects for young people through the establishment of the Icelandic model in Canada. Your committee heard directly from the founders, I believe, of this model on how it's truly making a difference in the lives of youth across Canada and around the world. We are funding projects through the Substance Use and Addictions Program, which provides time-limited funding for innovative, evidence-informed projects. And together, these initiatives are helping Canadians access high-quality services no matter where they live. We're also working to improve access to mental health services, particularly for young people, and this is close to my heart, not just as minister, but as a mom to teenage daughters. I've seen firsthand the challenges that youth are facing. Schools, social media, peer pressure, and global conflicts are all having an impact on their mental health. Community organizations are a lifeline when it comes to mental health. We introduced the new Youth Mental Health Fund to make sure that young people have easy access to mental health services by the organizations that they know and trust in their communities. Additionally, the supplementary estimates propose $7.5 million to support Kids Help Phone. This will allow them to continue to provide 24/7 access to bilingual mental health supports for youth over the next 3 years. The Public Health Agency is also receiving $1.9 million in new funding for the Mental Health for Black Canadians Fund to support development of culturally focused knowledge capacity and Black-led programs to improve mental health for Black Canadians. Our government is also proposing to allocate $15 million to help first responders deal with mental health issues. They have been there for us before and now, during and after the pandemic, and it's so important that their government be there for them in return. These are just a few examples of the work we're doing to ensure that high-quality mental health and substance use services are accessible right across the country to Canadians. At the same time, we will continue to work with provinces and territories so that mental health and substance use care can be fully integrated into their healthcare systems. I am now happy to answer your questions. Back to you, Chair.
Thank you, Minister. And we will begin now with rounds of questions, starting with the Conservatives. Ms. Goodrich, please, for 6 minutes.
Thank you, Mr. Chair, and thanks to the Minister for being here and agreeing to stay for a full hour. Very quickly, have you believed that decriminalization has been successful in British Columbia?
Thank you, Chair. The only person, or I would say party, that's preoccupied with decriminalization is really the opposition. When we chose to embark...
We have a tradition in this committee, as you're well aware, that the length of time you get to answer is approximately the length of time that the person took to ask the question. So has decriminalization been successful in Canada, yes or no?
Again, Chair, it seems only the opposition is preoccupied with national decriminalization. We work with jurisdictions as per their request.
So the Canadian Association of Chiefs of Police and British Columbia's Association of Chiefs of Police have both pulled their support from this failed Liberal program and policy. Will you say that it is a success, yes or no?
I had the opportunity to speak with the CICP directly, and we are all in agreement that all tools are needed to address the toxic drug supply.
Will you rule out rolling out this failed policy anywhere else in Canada?
I commit to always working with jurisdictions with both their health and community safety measures to ensure that we're reaching people who are struggling with addiction.
This is a failed policy that has caused carnage. We are seeing 22 people die every single day across Canada due to the overdose crisis, and your government is failing. Why will you not rule out expanding this failed program?
Mr. Chair, it seems that the Conservatives are big on outrage, but not so great on when it comes to work and evidence. We continue to work with provinces and territories, as health is their jurisdiction, as is law enforcement, to ensure that a full suite of tools and measures are there to save lives and get people health care, which is what they need.
So will you rule out rolling this failed policy to anywhere else in Canada?
I commit, as always, to work with every province and territory in their jurisdictions, working on health care and collaborative law enforcement, because that is what they are asking us to do. I don't think the federal government should be dictating to provinces and territories what is their jurisdiction.
The BC Association of Chiefs of Police have pulled their support for this failed policy. Public safety is at serious odds due to this failed policy. Why will you not pull your support and end this now?
So Fiona Wilson, who's the president of the BC Association of Chiefs of Police, said herself that we need a balance between community safety and health care. This is what we've committed to in working with jurisdictions to ensure people get help and health care.
All right.
It needs a balance.
Thanks. I'm going to move on to something a little different. We know that Canada has become a major producer of fentanyl in this country as a direct result of your government failing to do anything when it comes to banning precursors for fentanyl. What are the timelines for actually banning these precursors so that fentanyl is not being produced here?
So unfortunately, the Conservatives are misleading Canadians, because the fact is that Canada is a world leader in precursor regulation and scheduling of precursor chemicals. As a matter of fact, we have a class scheduling system, which means that we not only look at individual chemicals, but classes, so that we can be nimble and flexible in the face of an illegal toxic drug supply.
So about 6 months ago, we had BC RCMP Assistant Commissioner Will Nigg come to committee, and he said that they've been advocating to government for the last 2 years. So it's now 2.5 years to have these deadly precursors banned in Canada, and yet 80% of them are still completely unregulated. Why?
So yet again, Chair, the member is misleading Canadians because precursor chemicals are found in things that we use daily, whether it's plastic, rubber, paint supplies, and so on. This is why they must be scheduled and regulated, which is something that we do on a regular basis. And again, have a world-class system that works in collaboration with the United States and international partners.
Okay, well, at the SECU committee, the RCMP Commissioner Duhaime confirmed that Canada is a net exporter of fentanyl. Does that not concern you? Are you not applying every single tool in the toolkit to make sure that Canada is not exporting fentanyl?
I'm absolutely committed that we use every tool in the toolkit. These are questions to be asked of the Public Safety Minister. As I said, we schedule and regulate, but working across departments and working with border services and with our U.S. counterparts is critical.
So what are you doing to advocate to the Minister of Public Safety, who now has multiple hats, when it comes to banning these precursors?
So just to be clear, when it comes to precursors, they're essential. The precursors that are essential for making fentanyl are already restricted and prohibited. So
But
again,
we're a
the
net
member is
exporter of
misleading.
fentanyl. We're an absolute net exporter of fentanyl. We are having massive drug busts every single day. So the next question is, do you support the Prime Minister or Chrystia Freeland?
Mr. Chair, I don't believe that question is relevant to my
I think it's very
portfolio today.
relevant.
Yeah, I agree.
Well,
Move on,
I
please.
think it's very relevant. Do you support the Prime Minister?
Yes.
Point of order, Chair.
You have a point of order from Ms. Kayabaga.
I think we should stick to the intended discussion of the meeting, and so Mrs. Goodridge could stick to the relevant message. Thanks.
Yeah, I'm inclined to agree. Unless you can tie the question to the estimates, it really is out of line. So you have about 16 seconds left. Ms. Goodridge, go ahead.
We're hearing that there's going to be a cabinet shuffle later this week. Are you still going to be
Point
the
of
Minister
order,
of Mental
Chair.
Health and Addiction?
Point of order. I'm sorry. Let's move on.
The same point, I take it?
Yes.
Do you wish to answer that, Minister?
Sure. I don't deal in hypotheticals, as the member well knows, and I've been asked to appear as the Minister of Mental Health and Addictions today to answer your question, and that's my intention.
Thank
So-
you. Thank you.
Thank
Ms.
you.
Thank you, Ms. Goodrich. Thank you, Minister. Next, over to the Liberals, Madame Brière, pour 6 minutes, s'il vous plaît.
Thank you, Mr. Chair. We know youth today are facing many challenges and have unique mental health needs. Last month, you announced the launch of the Youth Mental Health Fund. Call for proposals. Can you tell us more how this fund of $500 million will help support community organizations and building capacity to better serve youth clients, especially those from underserved groups?
Thank you, and through you, Mr. Chair, merci à ma collègue. I'm so sorry you're
Thank you to my colleague.
challenging today. So in Budget 2024, this government made a once-in-a-generation investment in our young people across the country, because we know that when our young people thrive, Canada will succeed. And the Youth Mental Health Fund is intended to invest in our young people in the services and community organizations that they trust in their communities to help them build the resilience, prevention tools, and really the toolkit for good mental health as young Canadians, but also as they move forward in life. So the fund will be supporting community mental health organizations from coast to coast to coast. Our consultations ranged from youth from across the country, both from Indigenous communities, urban communities, marginalized and racialized communities, newcomer Canadians, to ensure that we had the full breadth of understanding of what our young people are faced in challenges today. As minister, and I often say as mom, this is a critical point of service that we're investing in our young people, because we know that they need those supports and we want to be there for them.
Thank you. It has been 1 year since the launch of the 988 suicide helpline. Can you speak to initiatives undertaken by BHAC and CAMH to further enhance the network?
Thank you, and through you, Mr. Chair, we just had the 988 anniversary, and some of the successes of our first year of this national project in compassion and caring and showing up for Canadians meant that we were there for 300,000 calls this year and texts, which meant a lot to Canadians across this country. We have 39 organizations that are on the front lines of this work with incredible volunteers who are committed to being there for someone in their moment of crisis. And I think it's a place of pride for us as Canadians that this is a compassion network that is meeting people when they're in those critical moments. 300,000 calls and texts, 29,000 calls and texts per month, or nearly 1,000 a day, means we are meeting people in their most challenging moment, and I think that's something we can all be proud of.
Thank you again. The loss of a loved one to suicide leaves ripple effects on entire communities and lifelong trauma within families. Can you speak to the progress being made on the National Suicide Prevention Action Plan?
Thank you, through you, Chair, and really I want to thank Mpri Briere for her work on this file as well. We announced the National Action Plan Framework for Suicide Prevention late in May, June of this year. This is an all hands on deck, all province and territory Canadian initiative. All provinces and territories have agreed to be part of this framework in understanding how we meet Canadians in terms of suicide prevention. We know we need to do more. The numbers are challenging, particularly in the northern part of the country and for Indigenous youth. That being said, we have taken an all of Canada approach to this and learning from one another from across the country of what services work, what more needs to be done, and how we can truly support Canadians. And this is really an example of when collaborative work across jurisdictions is at its best.
Mr. Chair, I think I'll leave it there.
Thank you. Merci, Madame Briere.
Thank you, Ms. Briere. On to Mr. Thériault for 6 minutes. Thank you, Mr. Chair. I also seem to be losing my voice, but it has improved since last Thursday. I won't need to speak very loud to be heard. Am I heard? This is the interpreter. Can you hear me? I'm very sorry about that. And this is the interpreter.
Est-ce que ça fonctionne?
Is it working now? All right. As I wasn't saying anything very important. I didn't take a chance. I just tested the sound, is what I was doing. So here we are in December. Last year, at this time, we were starting a study on toxic drugs, and we've been working on it for a year. We visited the major cities across Canada. Here's a question I'd like to ask you, and I will give you a real opportunity to answer. How has the addition of your department made a difference in order to resolve this crisis?
Merci, and thank you.
Thank you.
I want to acknowledge the work of this committee in its continued study on the opioid crisis, but also express my disappointment that Conservative members chose not to participate in the very important on-the-ground tours that were done to understand evidence-based models across the country. I will acknowledge other colleagues on this committee did take the time to understand what is needed to save lives and to save Canadians and loved ones. Our department has done a number of measures when it comes to addressing the illicit toxic drug supply, working with jurisdictions. To be clear, harm reduction, treatment, and aftercare are squarely placed within the realm of healthcare administration of provinces and territories. Our role as a federal government is to work with jurisdictions to find the tools that work, that make sense for communities. That's why we invested $200 billion in bilateral agreements with jurisdictions, of which mental health and substance use is a key principal priority, to enable jurisdictions to determine what tools make the most sense in their jurisdictions in order to save lives and help those who struggle with substance use and addictions to get the health care that they need. That being said, we have the opportunity to work with communities to augment and support those services additionally, whether it was through the SUAP this past year of nearly $144 million in investments in community organizations across the country, ranging everything from prevention, harm reduction, training and education in communities and supporting, as well as the Emergency Treatment Fund, which we launched last month, which will add additional layers of support in community for emergency crises.
Oui, toujours est-il qu'on a ventilé.
That said, money was spent under 4 fields. For example, mental health and addiction. We added $4.6 billion to spend over the next 10 years, thinking that we would be able to resolve issues such as mental health and a toxic drug crisis. I do understand what you're saying, and I'm happy to hear you say that this is indeed a question of shared responsibility. Sometimes there are some issues that come up at the committee that end up being the federal government's responsibility, but realistically, the federal government can only do so much when you look at what frontline workers are putting up with. We can change laws, but those who are making a change are actually on the ground and with those who are, at risk of having an overdose and who are actually saving lives. In my opinion, they need more resources. Do you think that these bilateral agreements have facilitated the transfer of money? What I've heard in Quebec is, for example, the Fund for Youth Mental Health, is that an agreement has not really been made yet, and that the money has not quite yet been sent to Quebec. Your answer seems to be that you've made a difference by investing money. But besides just sending money, how has your department and how can your department actually help to resolve these crises? Because money is not enough.
Through you, Mr. Chair, I want to thank my colleague for the question. And I can tell you that with the bilateral agreements, there are data points and data sets that we'll be seeing at the conclusion of the first year of the agreements to see where investments have gone and who has been impacted and received services. So it will be a benchmark for us to understand how those funds, specifically in the bilateral agreements, are being used. But I would like to share with a colleague from the Bloc, since he is here representing Quebec and Quebecers. I was pleased to join Minister Lionel Carman in October, specifically on the SUAP, for an example, of $86.8 million in investments to the province of Quebec, to organizations. 90-plus projects were identified in a very collaborative way, which I have to say is really an example of what happens when jurisdictions work well together to set priorities and meet the needs on the ground with community organizations. So we do know that the funds, particularly in Quebec, are getting to the organizations that are doing that frontline work. And we will always work collaboratively with every jurisdiction, whether it's through SUAP, ETF, or the bilateral agreements, to make sure that we have provided federal resources to address this crisis, and that our expectation is that jurisdictions scale to need with the healthcare services that they must meet for their citizens.
Merci, Madame la Ministre. Merci, Monsieur Thériault.
Thank you, Madam Minister and Mr. Thériault.
For 6 minutes online.
Yeah, thank you so much. And thank you, Minister, for being here. And I particularly want to thank your staff and, of course, the public servants that are there for the important work they're doing. Minister, time's running out on this government, and it's yet to still fulfill its promise to make mental health care a full and equal part of our universal public health care system. And a report that was released last month by the Canadian Mental Health Association on the state of mental health in Canada, it found that the mental health of Canadians is 3 times worse than before COVID-19, and millions of Canadians still can't access the supports that they need. This was clear in that report. And yesterday's fall economic statement was perhaps your government's last chance to move forward with its promised Canada mental health transfer. But again, it was nowhere to be found. While the economic statement contained $17 billion in new spending for helping business, the government has really abandoned Canadians struggling with their mental health, their communities, their families, and really our overburdened healthcare system. Do you believe that all Canadians should be able to access mental health supports with their health card, not their credit card? And if so, why is your government not being able to make that a reality after almost a decade in power?
Thank you. And through you, Mr. Chair, what I will say is this, that since 2015, this government has been committed to making historic investments in the mental health of Canadians. In 2017, $5 billion began to flow to provinces and territories to increase the availability of mental health care, in addition to almost $600 million for distinction-based mental health and wellness as a key part of the strategy of how we address the needs of Indigenous communities across the country. And as I said earlier, $500 million was made was put down as an investment in Budget 2024 to our youth, an additional $140 million to support veterans. This is also layered into the $200 billion over 10 years to provinces and territories where mental health and substance use is a key component of the principles of those agreements. Mr. Chair, as the member well knows, we will continue to provide the investments that jurisdictions must make in their healthcare systems so that Canadians can access mental health services where and when they need them. We always work collaboratively with jurisdictions and encourage them to put forward priorities that meet the needs in their jurisdictions. That being said, we are always here to do more, but jurisdictions also need to do their part with the funds that they've been provided.
Minister, we could have a long conversation about that, but the next question, basically in 2013, so here we are 11 years later, the Mental Health Commission published a report estimating the annual direct and indirect costs of mental health for Canada and making the case for investing in mental health. The report found estimated that the annual direct costs of mental health illness for the Canadian healthcare and social support system would reach $79.9 billion in the year 2021 and $156 billion by 2031. The report also estimated that mental illness cost the economy $6.4 billion in lost productivity. This is back in 2011, and that it would rise to $16 billion by 2041. Now, research has shown that investments in mental health produce savings for society. Canada continues to underfund mental health. Do you believe there is a fiscal case for increasing investments in mental health, given that economic and social challenges in Canada and what we're facing? And if so, why did the fall economic statement not propose those investments?
Thank you. And through you, Mr. Chair, I will agree with the member. Mental health is health. It is a key component to the well-being of Canadians across this country, young and old, which is why the many investments that I listed in my previous answer are so important. But as mentioned, provinces and territories are the primary deliverers of our healthcare systems, and this is why we work with them. I am a firm believer in Section 3 of the Canada Health Act, which states the primary objective of Canadian healthcare policy is to protect, promote, and restore the physical and mental well-being of Canadians. We continue to make those investments, and we expect provinces and territories to live up to their commitments under the Health Act as well.
Minister, the government updated the Canadian Drugs and Substance Use Strategy in 2023, but it contained no real plan with a timeline or resources to respond to the toxic drug crisis? When will we finally see an action plan to mobilize an emergency response and allocate enough resources to finally end this tragic crisis? And you can, put the blame on, the provinces and territories, but when is a plan coming together to bring everyone together with money and resources to implement?
Thank you. And through you, Chair, I will say that since 2016, this government has put nearly $1 billion worth of investments in addressing the illegal toxic drug supply and the overdose crisis. We have always, and I will continue to work with provinces and territories on the 4 key principles of a strategy to address the toxic drug supply and the overdose crisis. That means prevention, that means harm reduction, that means treatment and aftercare, but also community safety. These are all key pillars to this work. We work with jurisdictions to understand the needs that are local and pertinent to their communities and respond as jurisdictions ask us to respond with them. Collaboration is the key to this work.
It's not even close to enough, Minister. It's not even close to enough.
Thank you, Mr. Johns. Thank you, Madam Minister. Next, Dr. Ellis, please, for 5 minutes.
Thank you very much, Chair. Thanks, Minister, for being here. There's a statement: alcohol is a leading preventable cause of death, disability, injuries, accidents, and social problems. Do you believe that, Minister, to be true?
I think that alcohol is a substance that unfortunately is used by too many across this country without an understanding of what the health impacts of it are. We continue to do that work in prevention and education through the Public Health Agency
Minister,
of Canada.
I'm not asking you some trap question here. That's from the Canadian Guidance on Alcohol and Health, the final report. It's a simple question. Do you believe that alcohol is a leading preventable cause of death, disability, injuries, accidents, and social problems?
I believe that abuse of alcohol consumption can be detrimental to one's health.
Wow. Okay, I can see the game you want to play today, which is very sad on behalf of Canadians, Minister. The other thing that's incredibly sad is that your government put forward a temporary tax trick on Canadians, which included removing temporarily for 2 months the GST on beer, wine, and ready-to-drink alcoholic drinks. How did that make you feel, Minister, when that came across your desk?
The GST tax break for Canadians was meant to address and does address affordability concerns that many Canadians across the country have shared with us. And in responding to that and listening to Canadians, particularly during the holiday season, we wanted to ensure that they were able to have a break during this time in the holiday season when they're gathering to celebrate.
But Minister, your government is promoting, by reducing the price, consumption of alcohol. Is that not true?
The GST tax break is for Canadians to make the choice of what goods they wish to purchase to enhance their holiday season.
I guess what I would say to you, though, Minister, the member from Canada Carleton made an interesting video quite clearly encouraging Canadians to drink alcohol, showcasing a bottle of wine. Is that not true?
I do believe the leader of the opposition has been in multiple videos grabbing a beer with folks and promoting it as well. So
Minister,
I'm not really sure what the point
Minister,
of your question is,
one of the most effective
Chair.
ways we have to help Canadians, is it not true that, again, why didn't you include cigarettes in that? Why did you not reduce the taxes on them? Why would you, as a member who represents mental health and addictions in the failing government, think that that's a good idea on behalf of Canadians to reduce the GST on beer, wine, and ready-to-drink alcoholic drinks? Explain that to Canadians. It's a simple question.
Through you, Chair, I believe I've answered the question with regards to the GST tax break for Canadians in addressing needs of affordability. Our Office of the Mental Health and Addictions, as well as Associate Minister of Health, is to ensure that we provide resources for prevention and so that Canadians can make healthy choices no matter what they eat or consume.
But Minister,
and this is the work that we do at the federal government.
If I might, did your department have any input into this policy? Did you know this was going to happen, or did they do it behind your back?
The GST tax holiday for Canadians is to address affordability.
That's not what I asked you. I said, did your department, Mental Health and Addictions, have any input into the temporary tax trick, or did they do it behind your back?
as the member well knows, cabinet confidence is that, and the decision was to provide a tax holiday to Canadians.
So clearly, on behalf of Canadians, you would like to see them drinking more alcohol. That being said, Minister, what about the other parts of the temporary tax trick? We know that Canadians are having difficulty affording food. Your government supported a private member's bill, C-252, that actually wanted to reduce advertising to kids, and now you're out there saying that children, it's okay because we've reduced the taxes on it. You should eat chips and candy and coated popcorn and curls and twists, etc. Is that something, again, inside your portfolio that you agree with, Minister? Yes or no? It's not a difficult question.
So through you, Chair, it seems now that Conservatives seem to think that the tax is perhaps good, or that we should be evaluating this as public policy and how it relates to the price on pollution. I'm not really sure where
guess, Minister, what
Conservatives
I'm asking
stand
you to
on
do,
ensuring
which-
affordable. Chair, I do believe
Minister,
that I
excuse
have
me,
the floor.
I'm just going to interrupt you there.
I do believe I
You know,
have the floor,
I think
Chair.
the big thing is, Chair, is that
Minister, there's about 10 seconds left in this round, so make your
Yeah.
point.
I guess the question is, Minister, is why would you, as the Minister for Mental Health Addictions, support encouraging Canadians with unhealthy behavior? Sadly, Minister, that's your job. Sadly, it appears you don't know that.
Take 15 seconds to respond, Minister, please.
Sadly, Conservatives don't seem to believe that Canadians should have a tax break. So again, outrage is big but weak on action. Thank you, Chair.
Ms. Kayabaga, please,
I
for
like
5
beer.
minutes.
I just don't think we should encourage
Thank you,
Canadians to drink it.
Chair. Through you, I'd also like to thank the Minister for coming back to our committee to address some really important policies for Canadians. Through you, Chair, I would just like to hear from the Minister on, we've had quite the testimonies from different families and families in my community as well that are impacted by the overdose and the opioid crisis. And one of the things that I think the last family that was here mentioned was the politicization of, people who are struggling, people who are sick, people who are hurting, versus finding solutions that are long-lasting for Canadians. Can you talk about how you can do that work, respecting the dignity of the families that have lost a member, that are struggling with this raw disease that's attacking our communities right now, and still find the solutions and the preventions that's needed for young people and the support that those families also need?
Thank you for the question. Through you, Chair. I meet with so many families and community organizations across this country who are at the front lines of trying to save the people they love. And sadly, what we've seen from the opposition in the politicization of this opioid crisis is that they choose to look away from those who are struggling to lean into solutions that are not evidence-based, that don't meet people where they're at. So to get someone to treatment, we need to build trust, not just for the individual, but the families and the communities around them, to get them to health care. My commitment to families is that who are really struggling under the weight of a loved one who uses substances and may be struggling with addiction is that we will not look away. We will use every tool we have working with jurisdictions and making those investments in community, because we see them, we see the families, we see the people who are struggling. And it is our commitment to ensure that jurisdictions scale to need with the resources that we have provided and additional resources that they have in their toolbox to ensure that they are getting health care. I think it's incumbent upon all of us to remember that at the center of this crisis are the people who use substances and need our support, not only so that they stay alive, but that they can get to accessible treatment and also have the aftercare services so that they can get back to health and wholeness.
Minister, one of the things that someone who testified in our committee said that language matters when we're talking about this. And some of the words that I have heard throughout the study, I've heard things like drug lord, terrorists, gangs, What do you think is the impact of people who are watching this, who may want support, may want to get better, and the families who may want to seek the support for their loved one who is experiencing this disease?
I think that's such a critical question. Thank you, through you, Chair. Language does matter, because when the person standing in front of you is struggling, when you criminalize them, when you stigmatize them, when you essentially say that they are worth less and less deserving of health care and help, they will go back to a place and use and struggle because they have been shamed, because they have been told that they are not worthy of care. And we as a society, it certainly as a government, are fully committed to a compassion-centered, evidence-based healthcare lens, that at the center of it is the person who needs our support and help. So the impact of that, when we hear that language, is that they are dehumanizing and criminalizing loved ones who need health care.
Prevention was also a huge conversation in the testimonies that we've heard. What are some of the things that the government looks to put in place to prevent at a grassroots level, so that there's enough awareness and education for families and children to make sure that we can cut this disease from the bottom up?
That is, thank you, through you, Chair. So we have taken a number of measures at different aspects of society to create prevention frameworks. One of them is the No Opioids program, which tours across high schools throughout the country, engaging with high school students on what opioids are, how to identify them, prevent their use, how to recognize what a naloxone kit is and how to use them, to understand the Good Samaritan Act so that they are able and understand their role in saving lives. We've also Ease the Burden is a program that we've done for knowledge and resource bases for those who are in the trades. We know men are disproportionately impacted by the overdose and opioid crisis, so we wanted to ensure that there was a nationwide effort to provide tools to meet people where they're at.
Thank you.
Naloxone kit distribution is a perfect
Thank you.
example as well.
Thank you.
Thank you, Minister. Suite, M. Thériault, pour 2 minutes et demie.
Oui, la crise des...
Mr. Thériault, for 2.5 minutes. The toxic drug crisis is a complex issue. There are various ways to intervene, and there are 4 main ways. And most witnesses told us that there are various factors socially that impact that. Quebec has an interministerial process. Do you have an a plan of action that crosses different departments?
Merci pour la...
Thank you for the question. The short answer is yes.
I will elaborate. We've instructed our department to work with housing and infrastructure to ensure that we're addressing encampments and in the Reaching Home program, so that we understand that oftentimes substance use and homelessness and mental health go hand in hand. But in additionally, the CDSS, which is our main policy framework, incorporates 15 different departments.
Ma réponse que je cherchais, c'était oui.
The answer I was looking for was yes. How do you make sure that this plan is matching up with the Quebec plan? If it takes forever to implement, for the money to actually reach its destination, it makes it very difficult to actually collaborate. So how are you implementing it while respecting the jurisdictions? And beyond that, it requires funds. The Canadian Mental Health Association, in a report tabled in November, demonstrated that what is being done now for mental health is insufficient. $50 billion for mental health, in health in general, but only a fraction is for mental health. In Quebec, it's $60 billion for mental health. So why aren't you matching that with regards to youth's mental health? Why is there always this delay? The provinces don't owe you anything. You need to transfer money so that those who need to take care of people are able to do it. Unless you want to, shoulder the responsibility, I don't think it's in goodwill. That's your time, Mr. Thériault. Short questions, but that seems like it was a comment, rather. Well, no, it's actually an exchange.
Johns, please, for 2.5 minutes.
Well, thank you. Minister, in 2021, a motion to create a national perinatal mental health strategy received unanimous consent in the House of Commons, and the Canadian Perinatal Mental Health Collaborative estimates that treating perinatal mental health disorders costs an average of $2 billion per year and in Canada. And maternal mental health is also an important determinant for a child's health outcomes over their lifetime. If we're looking at making upstream investments in mental health, investing in perinatal mental health is perhaps as upstream as you can go. The Canadian Perinatal Mental Health Collaborative is calling on the government to invest $2 million over 2 years to develop a perinatal mental health strategy, which has the support of all parties. However, yesterday's fall economic statement didn't include new funding for perinatal mental health. Now, I know you've set clinical guidelines and spent $800,000 on that, but that's not a strategy. Minister, can you please provide us an update on what the government's doing to develop a perinatal mental health strategy?
Thank you, and through you, Chair. I'd like to actually take a moment, if I may. I've met with her on many occasions, but to thank Dr. Simone Vigaud from the Canadian Perinatal Mental Health Collaborative and the work that she has been doing with all of our partners to develop national standards that are really the foundational base for the perinatal mental health strategy. The work is ongoing. We are very close to the finish line on it. And it's really been informed by the advice of experts and people with lived and living experience. But I'll certainly say, as the Associate Minister of Health and as a woman and a mother, that oftentimes women get lost in the shuffle when it comes to childcare and the journey of pregnancy. And this is why this work is so critical and something that I'm certainly committed to, as well as the government. Perinatal mental health is a critical part of the mental health services that we are supporting and working collaboratively on.
Okay, still didn't get an answer, but Minister, I'll ask a very short question on decriminalization. You say you support evidence and facts. Can you tell us, since decriminalization was implemented, my understanding is that the toxic overdose deaths in British Columbia have actually dropped. Can you confirm that?
Thank you for the question. And we are seeing from the first data set of this year of approximate decrease of 8% across the country in overdose deaths in Canada. Is it enough? No, it's not. We need to do more. But when it comes to decriminalization, as I said before, it seems only the Conservatives seem to be polarizing this debate when we look at jurisdictions like Switzerland, Germany, Portugal, other places in the world that understand that to help those who struggle with substance use, we cannot stigmatize and criminalize them, but find avenues to get them to trust and enter healthcare systems. We know that we have a holistic system of healthcare.
Thank you, Minister. Next, over to Mr. Doherty, please, for 5 minutes.
Thank you, Mr. Chair. Minister, why is there no funding for a national suicide prevention strategy in the fall economic update?
The National Suicide Framework was launched in May, and the work is ongoing.
Minister, I just asked a question. Why is there no funding mentioned for a national suicide prevention strategy in the fall economic update? There's no funding.
As I mentioned, there is resources and work that is being done that is ongoing.
Minister, do you have a mandate letter?
Yes.
Has it been published?
It is the same mandate letter I've had since entering my office and position in 2023.
Can you state for us what your priorities are?
Chair, I do believe that my mandate letter is public and that he can reference it there. If he wishes to have it tabled to the committee, we can do that.
Minister, is part of your mandate letter to establish a permanent ongoing mental health transfer?
Again, Chair, I'm here to answer questions on the supplemental B estimates. If that is a relevant question, I'm happy to answer it.
Minister, is also part of your mandate letter to sustain improved access to virtual mental health services with Wellness Together Canada?
Wellness Together was a program that was established during COVID to meet the needs of Canadians.
But is that part of
during
your
the
mandate letter?
crisis. Again, Chair, is this relevant to the supplemental B estimates?
You tie the question to the estimates, Mr. Doherty, please.
Well, it all deals with spending of the government, Mr. Speaker, and if they're not mentioned in the fall economic statement, I believe it's something that the minister should report on.
It's fair game for Mr. Doherty to ask you why something isn't in the SUPs and get you to respond to that. So if you can answer the question, please do.
So thank you. And through you, Chair, what I will say is that my office is responsible to continue to respond to the needs of Canadians when it comes to mental health services. And the commitments that we made in Budget 2024, including the Youth Mental Health Fund and the Emergency Treatment Fund, are the priorities that in this budget cycle that we are placing emphasis on. That doesn't mean that we abandon other parts of the service system.
But if it's
However,
not, but Minister,
Chair, I'm answering the question if the member would
believe she's
allow
over
me to
time.
finish.
Mr. Doherty.
Yeah.
Yep. Go ahead, Mr. Doherty.
Minister, your government promised a 4.5 billion annual Canadian mental health transfer during the 2021 election. Was that promise abandoned?
The funding flow from that commitment has continued until its completion, but what we understood was that working with jurisdictions and understanding their needs in mental health meant that we had a renewed strategy through the bilateral agreements through a mental health priority.
Minister, you've referenced a couple times as a mother meeting people where they are. This is a final question. It's probably the last time I get a chance to ask you any questions in 2024, perhaps maybe even, who knows, in this government. I mean, only the future time will tell. This has bothered me for some time, and I want to give you an opportunity here. Do you regret shaking hands with Mahmoud Abbas?
Point of order, Chair.
Yes, Ms.
That's fair game,
Kayabaga.
Minister.
Point of order, Chair.
Yes, Ms. Kayabaga.
That's inappropriate as a question, and it does not match with what we're studying today.
Point of
To
order.
agree unless you can find a way
Point of order.
Point of order. Point of order.
Unless you can find a way to tie that to the estimates. Go ahead, Mr. Johns. Yes, on a point of order.
That's where I was going to go. This has absolutely nothing to do with the estimates. It's just completely out of line.
Point of order.
Ms.
On this
Goodrich,
point
on
of
a
order.
point of order.
I believe that the minister was actually there on official government business, and therefore it is relevant to the spending of the government. And so I believe if you let Mr. Doherty continue, you will understand how this is relevant.
Point of order,
Let
Chair.
Mr. Doherty continue if he wants to ask a question that is tied to the estimates.
Minister,
So
Chair-
far, I don't
Chair-
think it is, but
Chair, if you will allow, the minister has referenced time and again being a mother, and has made comments about Conservatives not being, if you allow, on the trip when they know that I was the member that was supposed to be on that trip, but I was at my mother's deathbed and supporting her
Point of
through
order, Chair.
her end of life.
yes, Ms. Kayabaga.
No, you
can't point of
order.
Point of order,
So,
Chair.
so finally,
No, he's apparently asking a question.
so
And
finally,
Ms.
Chair.
Kayabaga has a point of
Thank
order.
you, Chair.
I recognize Ms. Kayabaga. Ms.
Chair,
Kayabaga, go ahead,
I
please.
have the floor. Thank you. Chair, I don't understand where his question is going. He's talking about his personal mother. He's talking about a trip. He's talking about shaking hands with people. This has nothing to do with the estimates. Either we stick to the estimates or we call it a day.
Okay, I want to hear Mr. Doherty's question, the question that he has asked about shaking of hands. I think there was a valid point of order raised. I asked him to tie it to the estimates. I think he's trying to do that. Mr. Doherty, please.
So the point is, Mr. Chair, is that the minister has sat here for the last 45 minutes. She's made a number of assertions against the Conservative government without knowing any background, or perhaps not caring about the background. And so I think it is relevant when we have a minister of the Crown that is traveling on taxpayers' funds and somebody that is a proud Jewish member of the cabinet, whose daughter she introduced, who served. And so she has also referenced that throughout her testimony, that she's a mother. And she's brought that into her testimony. And so through you, Mr. Chair, I will ask her. I can't imagine that was a proud moment or an easy moment.
Point of order,
Okay,
Chair.
Mr. Doherty, the question is out of order and you are out of time. I recognize Dr. Hanley, please, for
You
the
want
next
to give her a
5 minutes.
chance?
Chair, I called a point of order.
Nope. Your question's out of order and you are out of time.
Chair, I
Dr.
did
Hanley,
call a
please.
point of order.
You have a point of order,
I
Ms.
did have a
Kayavaga,
point
go
of
ahead.
order. I called a point of order on the outrageous comment our colleague just made and borderline offensive to our minister, and I hope that he can apologize.
Dr. Hanley, please go ahead. Let's get through this.
Thank you, Minister, for being here, and thank you to all the officials as well for persevering. And Minister, I recognize also that you did refer to yourself with pride. Pride as a mother. My question is going to be very different, though, and it relates to some of the challenges that that teenagers face today. You and I are both parents of teenagers, and we know it's a challenging time. One of the specific questions actually is around students, post-secondary students, and how our government has made investments to support wraparound services for post-secondary students, particularly post-pandemic when there are so many extra stresses.
The Youth Mental Health Fund is so important in the scope of applications that we are receiving. It also includes university services, working in collaboration with community services. We know that students coming out of the pandemic were facing tremendous challenges in adjusting to life on campus, to new pressures, and really a different learning environment than the one that they had experienced in the pandemic, which is a key time of establishing milestones and good social habits, whether it's for study, work, and work-life balance. This is why we wanted to ensure that the Youth Mental Health Fund also was accessible for universities to apply. But that being said, we also know that students on campus are part of community life and bolstering both community services, and campus services is a key component of the fund.
Thank you. You and I were together in the Yukon. You came to visit the Yukon a few months ago. We traveled to Dawson City together. We met with many community groups, First Nation leaders. We met some wonderful youth and youth leaders in the Yukon. And specifically, you were talking about the Youth Mental Health Fund, which you've referred to, but also the Emergency Treatment Fund. And I wanted again to take time for you to elaborate on the Emergency Treatment Fund. I think it's not always intuitive what this fund actually is intended to address for communities. You talked about this a little bit in your opening statement, but when I think about some of our more remote communities, First Nation communities, can you explain maybe more with a pragmatic lens what this actually means and can mean for communities who are ready to apply for this fund?
Thank you. Through you, Chair. This is really a unique opportunity through the Emergency Treatment Fund to be on the ground in municipalities and in Indigenous communities across the country in addressing their urgent needs in relation to the public health crisis that we are seeing in terms of the illicit toxic drug supply and its impacts on overdose. This fund was intended to provide short-term support so that communities can rapidly mobilize and build capacity, because we know that communities are different. Some need enhanced supports that are culturally appropriate. We all know that oftentimes trauma and trauma-informed lens in delivering these services is needed and needs to be trained, but we also wanted to enable evidence-based substance use treatment, harm reduction, and integrated services to be scaled up in real time. In some communities, that could be ensuring that there are more outreach teams on the ground and distributing naloxone kits and referring folks to care. In other communities, it may be on-the-land healing programs that are underfunded that really need to address the needs in community. We heard from communities across the country that they needed a rapid response to meet immediate crisis needs. And this is exactly why we designed the fund this way as opposed to transfers to the provinces.
Thank you. I think 20 seconds. A plug for Planet Youth. Maybe you can take the last 20 seconds to describe what's important about Planet Youth and our investments in Planet Youth.
So Planet Youth is a unique program that really addresses youth in rural and remote communities in bringing together families and communities from a prevention lens, but also empowering young people to make healthier choices while being active in their communities and in their families. It's really such a positive investment and forward thinking in investing in our next generation of young people.
Thank you.
Thank you, Minister. Thank you, Dr. Hanley. Minister, that takes us to the end of the second round of questions and to the full hour as promised. Although I know you've been here for two, we appreciate you taking questions for the hour and for hanging in there. As always, and on behalf of the committee, allow me to wish you a happy Hanukkah and a restful holiday. I trust that you are going to be able to take some holidays. Minister, you're welcome to stay, but you're free to leave. We have next up some time with officials, depending on the will of the committee as we are approaching 1 o'clock. So I see Dr. Pelosi trying to get my attention. I wonder what he's looking for. Thank you, Minister. Dr. Pelosi?
Given Christmas is coming in the next couple of weeks, I'd like to spend the next few hours making merry and enjoying the coming Christmas. I hope the Grinch-loving Conservatives agree with me, and I hope they will agree with me in moving to adjourn.
Mr. Speaker, point of order.
A motion to adjourn is not debatable, but we can go straight to a vote. Is it the...
Mr. Chair?
Yes,
if we do,
Mr. Johns.
If we do, can I just make just a real quick comment for the public servants?
No,
that if
a
we
motion
leave?
to adjourn is not debatable. Is it the will of the committee to adjourn the meeting? It's not.
No.
Can we have a show of hands? All those in favor of adjourning? 1, 2, 3, 4, 5, 6. All those opposed? 1. Thank you, colleagues. The meeting is adjourned. 2. Really sorry that we weren't able to keep you here and ask you more questions, but.